Hi, I'm Art Kaplan. I'm at the NYU Division of Medical Ethics. Interesting results coming in from the biannual Medscape Ethics Report. This is done every 2 years, and we survey physicians in many specialties and find out their attitudes on a variety of topics. Important finding, controversial subject, physician assisted suicide. About 10 years ago, there wasn't that much support for physician assisted suicide, but I would say support for allowing it is growing very, very rapidly. That's what the survey shows. And why is that? What's happening? I think older physicians were more opposed to physician assisted dying, physician assisted suicide than younger ones are. I think we've seen many states move to legalize this practice with restrictions in the US, but most recently New Jersey, and there are many, many others that have done so, and there don't appear to be abuses of this. There has been no slippery slope toward killing the disabled, toward killing the incompetent, and I think doctors know that, and they tend to support legalization far more than they used to. The other big reason for the change, I think, is that the topic is being debated more and more by older Americans, and they want this opportunity to have a choice. Not that they want to do it, not that they want to end their lives, but I think more and more older Americans say, I'd like that option. And that belief leaks back to their doctors. So, this finding, I'm not really surprised about in any way that it is increasing support. And I think we're going to see more legalization in more states in the years to come. Random drug testing. Here I am a little surprised. There seems to be a lot of opposition to getting random drug tests, even though we know that drug abuse is a big problem among doctors and nurses. I think 43% of those surveyed this year said they still oppose random drug testing. I've been here before on this. I support random drug testing. I think we have to be careful about who gets to see the results. I think you should only do it if you have a program to help people with alcohol or drug issues. But for safety and to minimize malpractice claims, it still seems to me random testing is the way to go. Look, there are many other industries, the airline industry, the train industry, trucking, that have random testing, and it hasn't resulted in terrible impacts for airplane pilots, and I don't think it will for doctors. I think it will help more than it will hurt. So I'm disappointed that there seems to be increased opposition there. Another one that disappointed me, many doctors now are saying, 63%, that they could give speeches at drug company events and not be influenced by payment. I think that's delusional. Study after study shows that payment influences your opinions. It influences your prescribing habits. We know it's true. People still say, I can give a talk at a dinner, get a free meal, maybe take an honorarium, and not be influenced by the company paying me, but it doesn't square with the empirical data. I don't think I can do it, even though I feel pretty independent. When you get paid, or when you get a free meal, or when someone gives you a free trip, it still engenders a feeling of obligation subtly to be nicer to the people who are supporting you. So I still think this is something to be wary of. I don't think it's something we should let our guard down about. I'm not sure that people can really do what they think they can do and maintain the independence. But obviously, a lot of people in the survey just flat out disagree with me and don't think a free meal is going to influence their prescribing behavior. We'll have to agree to disagree on that one. Well, more upbeat, romance. The topic of romance appears on the survey this year and looks back 10 years. And the issue is having romantic relationships with a patient. 10 years ago, probably less than 1% of people thought that having a relationship while someone was your patient was okay. That crept up a little bit to 2% 10 years later. I still think that's wrong, shouldn't happen. probably illegal in many group practices, institutional settings, academic settings. They prohibit this. So it's not a big increase, but it's one I wouldn't go along with. If you're not actively seeing a patient, if the relationship is over 6 months, I think you can, reach out, see if there's interest, and try and see whether somebody is interested in going forward. Can't bully them, can't threaten them, can't use your position of prior power to initiate a relationship. And we certainly don't want situations where you're trying to do this if you think someone's going to continue to be your patient. But if it's ended and the relationship is over and you've let some time go by, I'm going to say bravo to romance, let it flourish. That is one way people meet, and I don't have ethical heartburn about it. So I'll end on a happy note for those of you trying to pursue love out there, trying to look for romance. And I'm Art Kaplan at the NYU Division of Medical Ethics. Thanks for watching.